For the assessment, the doctor's order, the client's level of consciousness and level of knowledge and understanding, then availability and functionality of the needed materials. So next is assess the client's mental status or ability to participate in the procedure. Then for the planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts preparation of the patient or the client equipments and timing. Then prepare equipments. First is introduce yourself and verify the client's identity and explain to the client what you're going to do, why it is necessary, and how the client can cooperate. Then perform hand hygiene and observe appropriate infection control. Then provide privacy. Hi sir, good day. My name is Mecca-Ella D. Cabe. I'm a student nurse for today and I'm going to assess your cranial nerves. By the way, what's your name, sir?
Jeffrey Suarez.
Okay, Jeffrey Suarez. I'm going to assess your cranial nerves and I will touch your body and there are some procedures that you need to follow. Is that okay with you, sir?
Yes, ma'am.
Okay, let's begin. So let's start our first assessment, the cranial nerve number 1 or the olfactory. So sir, can you please clear your nose? If that's okay. Then after that, I want you to close your eyes and cover your one nostril. I have this and I want you to smell, also describe the odor of this. What do you think, sir? Okay, he described this as maasim or sour because this is calamansi. The patient is able to describe the odor. So let's proceed for the cranial nerve number 2. We have this Snellen chart and ask the client to read it 2 feet away from the Snellen chart. Okay, can you start please? Okay, can you cover your right eye and read it again? Okay, cover your left eye, then read it again. Okay, thank you. So now let's assess the pupillary reaction by shining a pen light and observe the consensual reaction. Next is, so let's assess the cranial nerve number 4 and 6 or the ocular assess for ocular 6 ocular movements. So sir, I want you to move your eye from up right, up left, horizontal, down right, down left. Okay. Next is let's assess the cranial nerve number 5 or the trigeminal. So ask the client to close his eyes. Can you close your eyes, sir? Then tell me if the pain is asymmetrical. You feel the pain? Yes. Okay, then tell the client to close his eyes and feel for the light touch, feel the cotton. So sir, I want you to look up away from me. Then I'll test your corneal reflex. Wait. So let's proceed for the cranial nerve number 7 or the facial. Ask the client to smile. Sir, can you smile? Can you show your teeth? Can you blink your eyes? Can you pout your mouth or lips? Can you show your tongue? Can you close your eyes? And then open it. And can you raise your eyebrows? Okay. Then ask the client to identify various taste buds placed on the tip of his tongue. Okay, first we have this. I'll let the client to get the various things that I have. Okay? So, can you first close your eyes, sir? Then, I'll let you get a pinch of this. Then, place it on your tongue. Then, taste it. Tell me what you taste. Okay, so, next we have this. Close your eyes. Then, I'll let you dip your hand. Then, taste it. What's that? Okay, calamansi. Then lastly, we have this. Close your eyes. Do not open it. What's the taste?
Sugar.
Okay, sugar. Cranial nerve number 8 or the auditory assess the client's ability to hear the word or with the use of tuning fork. Okay, let's start. So, sir, I want you to repeat my words. Then I will cover your one ear. Okay, next. Orange. Okay, apple and orange. That's good. Next we will use the tuning fork. So we have the tuning fork. So sir, I want you to tell me if you hear the vibration on one ear or both ears. Okay, both ears.
Wait lang.
Next is place the tuning fork behind the ear. If he is able to hear the vibration. Okay, so as you can see, the client is able to hear the whispered words and able to hear the vibration. So let's assess the cranial nerve number 9 or the glossopharyngeal. So ask the client to open his mouth and let's see the tongue movement. So sir, can you say and open your mouth, then can you move your tongue down, up, side, right? Okay. So, next is let's assess for the cranial nerve number 10 or the vagus together with the cranial nerve number 9, the glossopharyngeal. So, let's check for the gag reflex of the client. Can you open your mouth, sir? Then, I'll assess your gag reflex. This might hurt a little. Okay. Then, can you say hello for your hardness of voice? Hello? Okay. So, let's proceed for the cranial nerve number 11 or the accessory. So, ask the client to shrug the shoulder, resistance their hand, then ask the client to move his head. Okay? Sir, are you able to shrug your shoulder? Okay, the client is able to shrug his shoulder. Then you follow me to move your head to the right, to the left, up, down, right, left, up, down. Okay, the client is able to move his head. So lastly, let's proceed for the cranial nerve number 12 or the hypoglossal. Ask the client to protrude his tongue. Sir, can you open your mouth and protrude your tongue? From right, left, up, down, up, right, left. Okay, sir, the client is able to move his tongue.